A lot of the initial presentation is driven by the effects of that low calcium, the hypocalcemia, especially in types 1A, 1B, 1C, and 2.
Right, the hormone-resistant types. What does low calcium do? It makes nerves and muscles much more excitable, so you can see neuromuscular issues, tingling sensations, often around the mouth or in the fingers and toes, that's paresthesia. Muscle cramps are common. More severely, you can get involuntary muscle contractions known as tetany, like carpopedal spasm where the hands and feet cramp up.
Okay, that sounds uncomfortable and potentially serious.
It can be. In really severe acute hypocalcemia, seizures can occur. There can also be cardiac effects, like changes on an ECG, specifically a prolonged QT interval, which can increase the risk of arrhythmias.
Are there any specific signs doctors look for during an exam?
Yes, there are classic signs we check for. One is Chvostek's sign. You gently tap on the facial nerve in front of the ear, and if the calcium is low enough, you'll see twitching of the facial muscles on that side.
Okay.
And the other is Trousseau's sign. You inflate a blood pressure cuff on the arm above systolic pressure for a few minutes. If hypocalcemia is present, it can trigger that characteristic carpal spasm. The wrist flexes, fingers draw together.
Right, those are classic signs of neuromuscular irritability from low calcium. And then as we've covered, for those with PHP-1A, 1C, and PPHP, you'd also be looking closely for the features of AHO.
Exactly. You'd assess their height, look for that round facies, obesity, check the hands for brachydactyly, looking for those short fourth and fifth fingers, and the knuckle dimple sign feel for any subcutaneous ossifications, and ask about dental development issues.
And don't forget the other hormone issues in 1A and 1C.
Right. So you'd also be screening for symptoms of an underactive thyroid, like fatigue, weight gain, cold intolerance due to TSH resistance, and potentially looking for signs of delayed puberty or fertility issues due to gonadotropin resistance or short stature beyond just AHO. If there's growth hormone deficiency, it can be a multi-system thing.